Good evening all, I'm Diti Lama with the Thursday night edition of South Asian News, Vision of Asia. We are coming to you from our studio in New York City. Welcome to the show. Let's begin by taking a look at the coronavirus pandemic. Globally, we are looking at 64.7 million cases of the coronavirus with 1.5 million deaths. In the United States, we have surpassed 14 million cases and the death toll from COVID-19 in the US is now 274,000 and counting. US deaths from the coronavirus pandemic have surged past 2,000 for the last 2 days in a row as the most dangerous season of the year approaches. Cases are surging across the nation, putting a great strain on the healthcare system where many facilities are now struggling to support the burgeoning number of patients. CDC Director Dr. Robert Redfield has said that the winter months are likely going to be the most difficult time in public history of this nation. Looking at this surge, President-elect Joe Biden has selected 2 former Obama administration officials to senior roles in helping combat COVID-19 in the country. It includes South Asian American and former U.S. Surgeon General Vivek Murthy, who will be returning to his former role. Dealing with the virus, which has killed Americans, as well as the economic fallout from the crisis, is one of President-elect's top priorities once he takes office on January 20th. Today, nation's leading health expert Dr. Anthony Fauci engaged with the Biden transition team to have his first substantive discussion about the pandemic. Along with that, President-elect Biden's first 100 days agenda includes a series of executive actions aimed at advancing his priorities and tackling racial inequality, which has impacted communities nationwide, especially where communities of colors are disproportionately represented and helped. Meanwhile, President Donald Trump again has yet to concede to President-elect Joe Biden, and his legal defeats are piling up. President Trump has also declined to say whether or not he retains confidence in U.S. Attorney General William Barr, who this week undercut the president by saying he has not seen any evidence of election fraud or tampering that would alter the election results. We continue tonight to look more at politics and the South Asian representation, along with updates from leading doctors on COVID-19. Here are the headlines. Dr. Purvi Parikh on surging coronavirus cases nationwide and vaccine, New York City. 2020 National Sikh American Survey featuring Executive Director Kiran Kaur Gill, SALDEF. Dr. Janish Kothari urges all to wear a mask, COVID-19 updates, Pennsylvania. Time for a short break. Stay with us on Vision of Asia, Voice of the Community. We'll be right back. And welcome back. I'm Aditi Lama and this is Vision of Asia, Thursday night episode of South Asian News. We are looking at the coronavirus pandemic's updates and measures on tonight's episode. Globally, over 1.5 million people have lost their lives due to COVID-19, with 1 death reported every 9 seconds on a weekly average. Half of the million deaths have occurred in just the last 2 months, indicating that the severity of this pandemic is far from over. The United States still remains the worst affected country, and we're now battling a 3rd wave of coronavirus infections. Yesterday, more than 2,800 COVID-19 deaths were reported here in the country, along with more than 100,000 patients reported in U.S. hospitals. Leading medical professionals expect the cases to swell further in the coming weeks, with holiday season causing increase in infections. Meanwhile, U.S. health experts welcomed British emergency approval of Pfizer's vaccine, while Canadian health authorities should soon complete their regulatory review of the shot. Bringing to you much insight into this and the impact of surging cases, we spoke with infectious disease expert Dr. Purvi Parikh. Urging all to wear a mask, here is Dr. Purvi Parikh. One of the biggest topics that everyone is discussing today, yesterday reported more than 2,800 deaths in the nation. There is a prediction that if things are not in control, we could see even 3,000 to 4,000 deaths per day. Almost like a 9/11 scenario happening every single day. My question to you is, how are you looking at this and what do we need to understand from this?
Yeah, it's very troublesome, especially as a healthcare worker, because, I'm talking to some of my friends and colleagues who are actually on the front lines, like working in the emergency room and the ICUs. And it's just a very dire situation. I think people are getting tired of being alert. People are traveling more, and it's just worrisome that, December and January are just going to be very, very bad months, because we're just just now maybe getting a vaccine ready for early use. We're nowhere near the general public having it yet. So I know everybody's tired, but I think we really need to focus right now because we don't want a very tragic situation on our hands.
Yes, definitely not. There is another prediction that we may reach 20 million cases by January 20th, which is the inauguration day for President-elect. Do you agree with that?
It's possible. I mean, the pace that we're going at, it doesn't seem to be slowing down. It's the opposite. And then again, even though the CDC warned against Thanksgiving travel, there were packed airports, a lot of people, not even just flying, but a lot of people were driving. I think people think it's safe if you drive, but majority of these cases are transmitted in the home, actually, so even driving comes with risk, even if it's a family member, if you haven't seen them in a while. So, I think it will continue to go up for the next 2 weeks after Thanksgiving. And then again, with Christmas, New Year's, other holidays coming up, I fear that it will continue to increase unless people act a little bit more cautious and vigilant.
Yes, definitely. The Midwest and the west of the country right now is ravaging with COVID-19 cases. I would like to know what you think is the key reason for this surge, because it's overwhelming the hospital, just like hospitals were overwhelmed here in New York City in March. We've learned so much from then. Why are we still seeing that surge, and is there any indication we're also going to be impacted in the tri-state?
Yeah, I think the surge is coming basically from collective behavior. I think people are tired, understandably. I mean, everybody is feeling pandemic fatigue, myself included. It's hard to keep vigilant for 8-9 months, but I think there are key patterns. So the surges are worse where there are not mask mandates. The surges are worse where there isn't as strict regulation over indoor gatherings. And the winter time, it was expected to see surges because all respiratory viruses spread more in the winter, including flu and other infections, because you're spending more time inside in close quarters. So it's a lot easier for things to spread from person to person. So I think all of those factors are leading to more surges. So, I mean, we've made more advances medically as we learn more about this virus, but I worry that if the volume overtakes the hospital's capacity, we might be in the same boat that we were in March, even though now we know how to treat it better medically. Resources are still the same, so we can't, exceed that.
Dr. Parikh, let's talk about masks real quick, because I think it's really important for us to get the word out even more. Some of the governors in the states that are surging with cases have not yet placed a mask mandate in public. How dangerous could that get?
I think it's very dangerous, and I guess I don't fully understand what the harm is in placing those mandates, because we have very clear data. I mean, New York is a great example. As soon as there was a mask mandate, the cases did drop significantly. And now, even though they're rising again in New York, it's not as sharp of a rise as we had seen before. So, I think it can be very dangerous. I mean, they say masks can reduce the transmission almost 70% between people, especially if everybody's wearing a mask. So I think it's worth doing. I know President-elect Biden has spoken of a possible national mask mandate, so it'll be interesting to see what happens from there.
We're talking about these overwhelmed hospitals. I have to ask you, what is the scene in these hospitals right now, if you could describe to us, and what are you seeing amongst your patients or the people that you're talking to?
Right. So, I'm an immunologist, so I'm not in the emergency rooms or the ICUs, but I hear firsthand from my friends, and the scene is grim. It's the same situation that we were looking at in March. But the difference is in March, the healthcare workers were more fresh, if that makes sense. Now, the healthcare workers are also exhausted in the same way everybody else is. So, ICU beds are filling up in many states to the point where, again, children's hospitals are being used for adult patients because there's not enough ICU beds. Same goes for the emergency room. So again, everybody is seeing more and more cases. Healthcare workers are falling ill. I think they said close to 900 employees were infected at Mayo Clinic in the last few weeks. So it's grim, because if you lose the healthcare force, again, like I said before, it's hard to take care of those patients. But then even in the outpatient setting where I am, we are seeing a lot of COVID positivity even there too. And it's not always mild for people. Some people really struggle. I've had patients that were recovering at home and then had to go to the hospital because they developed a blood clot in their lungs, or vice versa. So it's not by any means an easy illness, even if you do come out to the other side of it.
The soaring rates of infections and hospitalizations of COVID-19 has stunned the nation, with experts now predicting that the daily death count could regularly surpass 2,000 to 3,000 and perhaps even approach 4,000. This threatens to produce a 9/11-like death toll of 3,000 cases per day over the next 2 months and nearly 200,000 cases. Health officials say that they are running out of tools to constrain the virus. Remember, there were more than 2,800 deaths just yesterday here in the nation. The American Ambulance Association is saying that the 9/11 emergency call system is now at a breaking point, with cases spreading at an incredible rate in Midwest and the West. Meanwhile, eyes are again on the vaccine for COVID-19. On that, U.S. Food and Drug Administration panel of outside advisors will meet on December 10th to discuss whether to recommend the emergency use of Pfizer Inc.'s vaccine. Health officials predict the first inoculations could start days or weeks later. Several other vaccines are also in the later stages of development. So where are we heading in this winter, and how should South Asians take care of themselves? We spoke with Dr. Janish Kothari. Here is Dr. Janish Kothari. Dear message to the incoming administration, because they'll literally inherit this at possibly the worst time, as we're looking at almost 20 million cases as the prediction comes.
It's tough. I mean, I can't imagine what it's like for this administration to come in. It's a very steep uphill climb. And I think their first step is to have to make up for the deficiencies of this previous administration and make strides to reconcile the mistakes that were done. And were they mistakes because a lack of effort? Were they mistakes because of lack of knowledge? Was it a combination of these things? Since the beginning of all of this, we've learned a great deal, and we're continuing to learn a great deal. So I think the biggest thing that this administration can do is listen to the people in the position of knowledge, the people that have devoted their lives to, make a difference, the people that have devoted their life to healthcare. I'm not a politician. I'm not the smartest scientist in the world. But if I was a part of this administration, that would be my first move, to listen to the people that have a plan.
Yes, definitely. Let's now talk about something good that we are hearing this week, and something that's very promising, the vaccine. I have so many questions for you. Just today, the United Kingdom has become the first country to approve the Pfizer Inc. and Biotech Inc.'s vaccine. My question to you is, what insight do you have about it? And it's showing really high efficacy, and it's showing that it's very efficient, but looking at the number of people that were part of this trial, do you think that's enough? This is a two-part question, yeah.
Right. So before you understand what this vaccine is doing, you kind of have to understand a little bit about how vaccines work and how the human body fights illness. Whenever you get a germ, a virus, a fungus, or whatever foreign body that goes into us, right, our immune system has to make a reaction to it. We have to find a way to stop this infection in its tracks. So we have red blood cells and white blood cells and all these other immune cells that collect this host collect this infection that's come into our body, and we make antibodies. And this takes time. And sometimes it can take days, sometimes it can take weeks. And just in case we get reinfected with the same thing, our body's ready. And I always kind of explain to my patients when they ask me about vaccines and how the immune system works is if you're a person that's going into a club without a bouncer, you can just get in, Yeah. But if you're somebody that's going to go inside and create trouble, the next time you come to that same club and there's going to be a bouncer outside, chances are you're not going to be able to go in because that club has learned. And that's kind of what the immune system of our body is. These immune cells are the bouncers. They don't let foreign invaders come in and just wreak havoc. So what these vaccines are doing, they're very innovative. And lot of people have hesitations about vaccines and concerns about catching the illness and all that kind of stuff. I'm sure you've heard of it.
Yeah.
So these vaccines are great because the Pfizer and the Moderna one, they're mRNA derivatives, which basically means that this is a genetic code that's made from the virus. It's not the actual virus. It's these protein components. And this is a messenger RNA. It's a form of genetic code, and it's delivered into our body, and our body's immune system reads this genetic code and it transcribes it into proteins that we can use. So just in case we do get infected with that virus, that bouncer is already there. So that's basically how it's working. And what these studies did, usually when you make a vaccine, it takes 3 to 4 years because you got to go through rigorous trials, and there's always errors along the way, and you have to go back to the drawing board and kind of redo things and retweak things.
Right.
And, you have to look at safety protocols. You have to make sure you have the right amount of people, and you have to go through different phases and kind of do these studies. So with these trials, we have a total of like 100,000 patients that have been enrolled. So that's about 200,000 doses of vaccines have been given out. Right. To put that into a little bit of a perspective, when the Ebola epidemic in Africa was going on, their studies only had about 15,000 patients. And then when they were doing trials for the shingles vaccine, they only had about like 15,000 patients. So to put that into perspective, we have 100,000 patients that have been tested on these vaccines. Until date, we haven't seen any adverse events.
Wow.
A lot of infectious disease specialists and people that make vaccines, they know that most serious side effects, adverse events come within 6 months. So we're at a little over the 6-month mark since when these trials have begun, and they haven't recorded any serious adverse events. So with all that being said, it puts a lot of promise into this vaccine or these vaccines. And the efficacy is around a little over 90%. To put that into further perspective, the annual flu vaccine that we often get is only 40 to 60% efficacious. So these are really good numbers. And it really paints a picture into the development of vaccine. Does it always need to take 3 to 4 months? Maybe in the future, if we do, God forbid, come across another pandemic of this nature or even worse, we kind of know all the gears are in motion. We kind of know how to attack this in the future.
It's time for the short break. Stay with us in Vision of Asia, Voice of the Community. We'll be right back. Welcome back. This is Vision of Asia, the South Asian news segment, and I am Aditi Lamba. Let's now take a look at SALDEF, the Sikh American Legal Defense and Education Fund. SALDEF is a national Sikh American media, policy and education organization focused on advocacy and representation of the community through cultural, educational, political, and civic participation, along with social justice and religious freedom for all. On that, SALDEF recently released the first ever National Sikh American Survey of the Sikh American community in the United States, providing an accurate profile of the community in the US and serve as a resource for the Sikh community research, education, government, and nonprofit sectors. One of the key findings in the survey saw that approximately 93% of Sikh American citizens were registered to vote this year, and out of that, 96% of those registered voters said they were voting in the November 3rd general elections. Another key finding discussed that about 70% of Sikh Americans were bullied or harassed for their turban living in the south of this country. More on this and the impact of the survey in mobilizing the Sikh American voice, we spoke with SALDEF's Executive Director Kiran Gill on several key findings and details. Here is Kiran Gill.
So SALDEF stands for the Sikh American Legal Defense and Education Fund. We're the oldest national Sikh advocacy organization. We're based here in Washington, D.C. Our focus is on empowering Sikh Americans by building dialogue, deepening understanding, encouraging civic and political participation, and also upholding social justice and civil rights for all Americans, including the Sikh community and for all the American community. We have been extremely active during the pandemic with our programming, as many institutions and organizations have done. We have converted a lot of our programming to virtual programs. We actually, over the past summer, every year we run a program called the Sikh Lead Program, which is a program that places Sikh students in legislative internships, where they get a firsthand experience of working with the federal government or state government. We worked really hard this year to actually secure virtual internships.
Wow.
So we had 18 students across the country working in these internships. They got an incredible experience, not only in working in government, but also in advocacy work.
Wow.
They worked on a number of projects, which included a national Sikh survey, which got over 2,000 respondents from the Sikh community, and gave us real insight to issues of importance for the community. So we had some really exciting and incredible stuff. And of course, as many organizations are also providing the community with up-to-date information on COVID, the stimulus packages, and a lot of the other information that is essential for us as we move forward.
Definitely. Let's talk about Sikh Americans a little bit, Kiran, because obviously SALDEF focuses a lot on getting the Sikh American voice out, heard, and represented in all levels of the society. Talk to us about how COVID-19 has impacted Sikh Americans particularly, and have you seen them be impacted by the economic crisis or the healthcare crisis, and how have you been able to help them?
So it's interesting. I think, one of the tenets of Sikhism is seva, service to humanity, right? And a lot of times we think of it in the context of Sikhism, like a starting point is the Gurdwara, like we serve langar, many Gurdwara go out into the community and serve langars. So it's been a central point for the community. Not being able to go in person has been difficult, but the community has been extremely active nationwide, specifically on serving langar to the communities in need. There's been, activity from Florida to California to Michigan to DC. And I think the community is really adapting to this virtual environment and creating sangats and creating ways to do seva and support different causes, whether it be social justice causes, whether it be, humanitarian causes. So we really had to adapt, but I think the community is doing that right now.
Due to COVID-19, minority communities and communities of color have been disproportionately represented, and also they are having the most effect of this pandemic. Have you seen that in the Sikh American community?
The Sikh American community certainly has been affected, as in addition to other minority communities.
Right.
I think overall we are seeing the impact. We're trying to be safe, especially when we gather. We've given protocols to Gurdwara across the country about being safe when we gather. But certainly, yes, we have seen, unfortunately, COVID-19 hit our community as well.
Yes, definitely. Kiran, let's go ahead and talk about the National Sikh Survey. Lots of information to discuss here, and lots to discuss on why there was a need for that. So just starting that off, why did you think there was a need for this survey to be held now in 2020?
So Sikh Americans have been in this country since the early the start of the 20th century, in the early 1900s. But there has not been any national data collected to this scale on Sikh Americans to date. So when we go on the Hill and we do advocacy work, when we talk about, for example, experiences of the community, whether that be hate crimes, whether that be workplace discrimination, whether it be economic issues, we don't have that data to back it up. So we have a lot of anecdotal evidence and what we sort of know from day-to-day experience. But having that data behind us is extremely powerful. Right? Because then lawmakers can really look at the numbers and say, wow, this is issues that heavily impact our constituents. These are issues that we can see there's broad support for. So having that is extremely valuable, and that's what we wanted to do. And it's interesting, actually, that we ended up doing it this year during a pandemic. There were certain challenges to that. But what we saw was an overwhelming response from the community to share their views, share their opinions, and provide feedback to us, which will be so important moving forward.
And Kiran, in terms of the survey, how was the participation, and what age groups did you see the most participate in this?
It was actually pretty evenly split. So the survey was open to those 12 and up, and we saw, a mix of younger Sikh Americans to elderly Sikh Americans. So really, we actually got a really good sample size, and we also got good national participation, which is what we're looking for. It's not up on our website yet, but it should be within the next month. So we have the data broken down by region. We should, by the end of the year, have it also broken down by state. So that'll be really interesting for everyone.
Well, this is all for tonight's show. Remember to send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on Facebook at itvgold. You can also subscribe to our YouTube channel for free access to many of our popular shows. Thank you for joining us tonight from Queens, New York. This is Vision of Asia, and I am Aditi Lamba. Take care and be well.